Sisi tuko katika biashara ya hotel. Sasa tukafikiria tufanye vipi tulete Dar es Salaam juu tena. Basi tukaona kama tunaweza kuleta hospitali nzuri ya cancer, especially and high tech diagnostic, tunaweza kukaribisha wageni kutoka nchi karibu zetu zote. Kama baada ya kwenda India, watu watatumia kuja Dar es Salaam. Ya pili pazuri ni kwamba tunayo Air Tanzania, inakwenda Bujumbura, inakwenda Lubumbashi, inakwenda Zambia, inakwenda nchi karibuni. Kama wao wanaweza kutuletea watu wagonjwa hapa kuliko wachukue kwenda India, tutapata nafuu na tutafanya Dar es Salaam kuwa nchi city ya health. Sasa hivi tumesaini kwamba sasa watatupa advice how to build the hotel after they have seen the plot.
Kiswahili
kidogo. Wameshatizama ile nini plot ni nini,
kiwanja.
Wameshatizama kiwanja, wamefurahi na kiwanja. Sasa watatupa idea namna kutengeneza. Kitu cha kwanza kanambia kwamba usiende juu, yani usitengeneze ghorofa 6-7, mwisho ghorofa 2, kwa sababu hospitali ghorofa 6-7 anasema ni sio comfortable kwa experience yao. Sasa watatupa advice yote, wataleta layout yao. Lazima tutakuwa tunalipa kidogo lakini hawa ndio watamanage the hotel, the hospital, kwa sababu hii hospital hawa wanayo experience sana. Na mtu akenda for cancer lazima ende Apollo Hospital India kutoka hapa, umeelewa? So nothing yet, hatujui tutafanya vipi, lakini tutakwenda pole. Kwanza tutajenga basic kwamba mtu akija anaweza kugundua kwamba anayo cancer au hana cancer, na kama anayo cancer kafika wapi. That is our first ya kwanza kuleta. Ndio maana tunasema tutaleta state of art modern diagnostic center, ndio wanasema, umeelewa? Kwa sababu na sisi tunataka watu watujue kwamba sisi hatutaki kufanya kazi bila kujua kwamba tunatumia watu wanayojua kazi. Ukitumia watu wasiojua kazi, unaweza kufanya testi chungu nzima usijue chochote. This is the experience of many people, kwamba wanafanya testi hiyo, wanafanya testi hiyo, hawafiki popote. By that time uko katika high stage. Ndio maana hawa watatusaidia namna tuende pole mpaka tufike tunapotaka kufika. So before we could do anything, ilitakiwa tusaini MOU kwamba hatutatoa, watatutupa advice, sisi hatutakwenda kwa mtu mwingine, kwa sababu tumesha saini mkataba MOU, umeelewa? Memorandum of Understanding. Ndio maana walisema kwamba hawatataka kwenda popote mpaka tusaini memorandum of. Sasa kutoka next week ndio wataanza kutupa information kwamba watapeleka architect yao kusema tutengeneze vipi hospitali, ikai hivi au ikai hivi au nini natakiwa, vipi tutaingia, vipi tutatoka, what is the, because we are not experienced.
Mpaka sasa hivi hamjui mtakuwa mnatoa huduma kwa wagonjwa wangapi?
Tumesema tutajenga hospitali ya bed 60 bed.
Okay.
Kubwa there is no control. You cannot build. Lakini mimi nasema kwamba lazima tutafanya ili wadokta wetu wajifunze pia. Umenielewa? Kwa sababu we need
Yaani Watanzania
wajifunze,
kupitia Hospitali.
sio kwamba namna ya kugundua kansa, namna ya kufuatilia awali, namna ya kufuatilia mapema.
Tatizo kubwa la kansa kwa Tanzania ni hatujui kwa mapema. Mwisho wa siku mtu anafika kutoka stage ya mwisho ya 4.
Stage ya 4 amesha sasa hamna kwenda nyuma awali. Ndio this will make us very strong with them. Okay. Then we can halafu tunaweza kusema haya, watu kutoka Comoro Islands, watu kutoka kule Tanzania ipo, hamna haja ya kupata visa. Ingieni katika ndege, njoni siku 3, tutakupeni ripoti. Hamna haja ya kwenda India. Afrika zote zinakwenda India. All African countries go to India. Kenya is the largest. Ethiopia, watu wote wana Sudan, wote, because the cheapest medicine is in Kenya, is in India. Yes. They think that they call it health tourism. Wanaita nini? Health tourism. Sasa sisi tulete health tourism Dar es Salaam, because Dar es Salaam is no longer capital. So let us make it the capital of health. 5 ndio wanakwenda waliokuwa na visa per year. Halafu watu wengine wanakwenda South Africa, watu wengine wanakwenda nchi za Amerika na Ulaya. Don't forget, people with money, they can go anywhere. So he has got only the number of people who apply for medical visa. Sasa sio lazima una apply medical visa, wengine wanaweza apply tourist visa.
There is something India UAE health delegation that you can see. So it's more like a joint delegation from India and UAE. They are visiting here today, yesterday and today, to discuss with government of Tanzania and to explore possibilities of investment with both government sector as well as private sector. But it's a nice coincidence that on the margin we are having a fructification of a separate initiative. We have the Best Healthcare Group of India, Apollo Group, which is a household name in Tanzania, and we have the Eclipse Group of Tanzania, who are coming together. It's more like, we are happy that it's a manifestation of India-Tanzania cooperation in health sector, that a Tanzanian company and an Indian company, they are coming together to set up a cancer hospital in Dar es Salaam. It would be in the city of Dar es Salaam. They have been in discussion for quite some time, and we are really happy. And it's a nice coincidence that it's fructifying today. I have with me the Deputy Permanent Secretary of Indian Ministry of Health, Mr. Love Agrawal. So we are happy that he is also present here on this occasion. So I welcome you once again. I'm sure both the stakeholders would say more about the project. Thank you.
No, you talk first. And a few fellow colleague clinicians whom I've known for a few decades for joining us on this announcement. Cancer as a disease knows no boundaries, no religion, no caste, no creed or any financial strata. It's a great equalizer. The challenge has been that people come at a very late stage because you don't get diagnosed on time, because lack of infrastructure, expertise or access. So the project first addresses that by setting up an advanced diagnostic center with a focus on early diagnosis, because earlier you diagnose cancer, you're in a position to move from care to cure. When you come in later stages, you can only probably provide care and intend to provide a certain quality of life with managing the patient in the best possible way. The statistics say that on average about 2,500 patients travel from Tanzania to India for medical treatment, which does not include the OCA numbers. And the number one in that is cancer. We believe that if we partner with like-minded individuals, and we are fortunate to have the Eclipse Group who have thought about us, and they have had a trailblazing track record of partnering with some exceptional partners, because they believe that what we're not good at, let's partner with somebody to do. With that intent, they chose us, which we are fortunate enough, and we would start phase 1, a state-of-the-art diagnostic center and a comprehensive cancer center in Dar es Salaam. Cancer can be managed today with expertise, technology, and service which is human. One of the things Mr. Zahid kept on stressing on is saying that to make sure it's accessible and that patients are seen in a human manner, and could we have clinicians who think in that direction. So it will have a mix of doctors from Tanzania, diaspora would like to come back, and also Indian clinicians who will help in setting up this entire facility. The facility is going to have a 60-bed cancer center in a 4-acre plot in the heart of the city. We hope to start the project somewhere in early 2023. In the next few months, we'll get into architectural drawings, concept, structural drawings, and then we'll go to the construction. And based on the pace of the work, we hope to see it completed within a period of about 24 months to 30 months. And it would probably reduce the gap that exists today, may not totally, I would say, mitigate. And it will also become an epicenter for patients to come from the neighboring countries where there's a dearth of oncologists. Comoro Islands, Namibia, Seychelles, Swaziland, Lesotho, Malawi, to name a few. And I think with the exceptional track record that we're getting to see from the Tanzanian airlines, that could be bridged, and they're also making rapid progress to make Dar es Salaam as the hub. I would urge the media to disseminate information on how early diagnosis of cancer could lead to cure, because the line is simple. It's earlier, easier, and that's the only way you can win over cancer. And the first step in that is also to make sure that you nip it in the bud early and get yourself diagnosed on a regular basis. And if there are vaccinations available, which today is there for a few types of cancers under the HPV strain, get yourself vaccinated. A neighboring country called Rwanda has got their entire population vaccinated for cancer, which has brought down the burden of cervix cancer from what it was to less than 5% in the last 4 years. It was a partnership between the pharma manufacturer. So the Indian Eye Commission is here. I would say that if there is a relationship that can be built, we can reach